Welcome to the CMU Civic Forum. Perhaps there's no greater or more relevant topic right now as it relates to civics and civility as the ongoing pandemic caused by the COVID-19 virus. CMU has made important decisions in response to the pandemic, but with us here today to discuss ongoing challenges and opportunities in our community is the Director of Mesa County Health, Dr. Jeff Kuhr. Jeff, thank you for joining me today and the CMU Civic Forum.
You bet, President Foster. Thanks for having me.
Well, we'll try and ask you all the hard questions, actually
Okay.
all the informative questions, but really, right now everybody's watching TV, on the internet, just consuming all sorts of stories about the coronavirus, and some that information's good, some bad, some's just dead wrong.
Yep.
And so I think you can really tell us and give us the basics about the coronavirus and the coronavirus in our community.
Okay. So the common cold is a coronavirus. So there are all sorts of different strains of coronavirus. As a matter of fact, a few weeks ago, there was the media responded to something down either in Delta or Montrose that a woman was positive for coronavirus, but it was the wrong strain, and so that was right at the beginning of all this. So this one is a strain that for which there's no immunity, so that becomes a novel virus, and so we see those every once in a while. The last one was in 2009. That was the H1N1 influenza virus, was a novel virus, and so as this spreads, once it gets person to person communicable beyond two countries, it gets declared as a pandemic. Okay. So we're in a pandemic right now. The virus itself is very easily killed. We know that just by washing your hands and using hand sanitizer, it impacts it. So it's not a superbug or anything like that. But it's, it affects certain parts of the population differently, and it just so happens for this particular virus that the risk groups are people that are 60 and over, or people that have underlying health conditions or a compromised immune system. So that's always what we look out for. But the thing about it is, every time we have, every influenza season, there are different parts of the population that are affected by that particular strain. So it's not, it's nothing to be alarmed of in terms of, gosh, this is the worst thing ever, and we're all doomed. Some folks need to take better precautions than others, and we need to protect them, and that's sort of our approach.
So it's really more trying to protect those susceptible populations, right?
It is. So this morning I read some document that said that actually there's a lot of younger people that are being hospitalized for this. We're starting to look at our U.S. data now that we've got so many cases nationally. And so that was interesting to see, but there was something that came out from the CDC last night as well that talked about the deaths, and so it was right in line with the death rate is higher. There's a direct correlation with age and the number of people who are dying from this. So younger people can be affected to the point of hospitalization, and there are numbers of those. But still, it verified that in the United States, our experience is that higher risk population is with the elderly folks, which I want to use that term. I want to clarify, I'm 58, so I'm just about one of those elderly folks
I'm
as well.
62, so you read elderly over 50 and elderly over 60, and
yeah.
I guess I'm an old guy.
Yeah.
I thought I was young, too.
I know, me too.
But first it was crowds of 250, then 100, then 50,
Yep.
then 10.
Right.
So talk to us about social distancing and maybe touch on why that's so important.
Yeah, it's so the whole thing is about that we need these rules to apply to everyone in order to have an impact. If we don't have those rules that that go across all of us, or that we all have to experience, then it becomes hit and miss, and some people will take more responsibility than others. So the social distancing is huge. In fact, for Mesa County right now, that is our state of the county, is we're in social distancing mode. And so, cutting off access to the restaurants, the bars, we went from 250 to 50 to now 10 as of yesterday. It's just all an effort to make sure that we're not not being forced into rooms where we're tighter than that 6-foot radius. Because, you know, early on I was even saying for Mesa County, well, gosh, 250 is a lot, but let's think about what spaces we're in as well. 250 people in some spaces forces you to be in very close quarters. And so I sort of think that's the thought behind this, is that once they get to 10, it's pretty generic, and we can be anywhere in groups of 10. So that's the philosophy behind it. It's all about social distancing.
So the social distancing, though, is also, or help me understand, because I go to the grocery store, I'm going to get closer to somebody than 6 feet.
Yep.
And should I be really always trying to keep a 6-foot distance, or how does that play out?
So social distancing and the 6 foot is important to consider, because let's talk about how this thing is transferred. It's right now, it's the symptoms are a cough, a dry cough. It's a lower respiratory, so it's a dry cough and lower respiratory. You can feel it in the lower lungs, and then a fever of 102 to 104. So the cough is the thing, and so the research has shown that the cough, you know, it aerosolizes when an uncovered cough can travel about 6 feet. And so that's where that whole thing comes from. And that makes great sense. And during influenza season, we deal with it as well, with sneezing also. And we try to show, how can we show how that works? If you take a spray bottle, or, you know, in the morning, if you use a room deodorizer, spray that thing and watch how long it takes for those particles to hit the ground. It takes a long time. So that's what that's all about. Distancing, maintain 6 feet, because if somebody happens to cough, they have symptoms, then that protects us.
So we've done a number of things going online. For example, modifying our dining services so it's takeout. Many of our employees are using technology to work remotely. Are we on the right track? Are there other things we can do, or how best for employers to work with their employees and their customers to try and keep everybody as safe as possible?
I think we're on the right track. I think it's better to do this earlier than later. The key to remember with this, and you'll hear this term, flattening the curve. And so some countries have done a good job of flattening the curve. What you don't want is the natural peak to occur. And where that flat spot is, it's in demand for healthcare resources. So as soon as we start to have a high demand on our healthcare resources, that's really the line that we're trying to stay below with our flattened out curve. So what we all do on a daily basis, if you can think, well, that's okay, I'm okay if I get sick. But going back to our highest risk populations of the 60 plus and the compromised immune system, those are the folks that all of these measures are ultimately going to impact and protect, because as soon as we put high demand on our healthcare resources, it's going to be, there's so many indirect effects to that that's where we do not want to be. And you see it, it's nothing new. We see it throughout the world when the healthcare resources have been hit hard. And in Mesa County, that's really our objective.
So what's going on in your world? I think, you're responding to, and you have a task force, and feels like people are beginning to move past the initial shock and into that phase of, how do I react? And so what are you working on this week? What's really the latest and greatest at Mesa County Health?
So this week we, it's always been important to us to pull in groups of people and inform them. And so we have a weekly call with community partners, and we have a weekly call or in person with our hospital partners. Yesterday was the first day that we sent out our daily update. So that went to about 500 plus people, and we invite people, if they'd like to receive that update, they can go to our website, which is health.mesacounty.us, and we'll send that update to anyone that wants it. But with all of that, the key has been communication. And so our next approach to that is, so it is including partners, but we've sort of been informing them and talking, at them a little bit, I feel. We want to engage our partners because everybody plays a role in this. So the next step that we're going to do, in fact, I talked to the city yesterday because there are small command centers that have to do with employers or the city, and they exist with the city, as I said. They exist with the school district, with CMU, and so next week I'd like to start to initiate a cooperative component to that whole command system, so that we can start to talk to each other about what resources we may have available and how we can share those resources, and even act, in consistent manners toward, each of our respective populations, but how can we all do it together so it looks seamless across the entire county?
So tell us again what that website is for people to be able to go and see kind of and it's a daily update, right?
It's updated all the time. It's health.mesacounty.us. And that's where we're trying to direct. The earlier question about what's the information and the misinformation, right from the get-go, we said we are going to put this website up, and it is going to be what we advertise, because the first thing we need to do is have everybody, getting the same appropriate information on this thing.
And it tells you number of cases in Mesa County.
Number of cases, all the various orders that have come out. And speaking of those orders, because we are receiving governor's orders, and those become orders from CDPHE, which is Colorado Department of Public Health and Environment. But we take those in and we modify them so that there is enough education to those that people can come to us as a resource, because they're pretty generic. And then, as you can imagine, that first day when the restaurant one came out, we had so many phone calls. My entire staff of restaurant inspectors were just doing nothing but manning the phones and answering questions. So we bring in those orders and we rework them a little bit so that there's enough guidance in there that educates people beyond what the simple order is.
Yeah, those are helpful when you do that. I know we have a dining hall and all of a sudden restaurant closure, and we were caught a little by surprise on that one as well. So Colorado Mesa has the opportunity to help.
Yes.
And I think we've communicated a lot, and we have I think we have more than 20 students who are stepping up and volunteering and trying to keep the pandemic under control as much as we can.
Yes.
And so we've talked a little bit about the resources we have and the fact that we have a simulation lab, and we can use that to help extend sort of that healthcare supply. But what are other things that we can do to help the community in this regard?
Well, we did, so you sent us a letter, and thank you for that, and talking about the resources that you have. And in fact, when I read it, I was like, holy cow, one more area where I'm thinking we need to do a better job of pulling in our partners. Now, let's put this into perspective. We've been fully operational in this thing for a week. So this is it's drinking from the fire hose, as they say. But yeah, so we met with Derek Wagner and David, and so our logistics person is now looking at the resources that you have available, because all we can do is plan for what's next and what's the worst case scenario. How do we respond if we get to a point? I'm saying we're not going to, but if we get to a point where we have to, what are the plans? So all of the resources that you have been pulled into my center, and my logistics people are now plugging those into, is this a resource for our next phase of operations with this thing?
And I think we suggested here pretty quick, we're going to have a lot of students moving out, and we'll be able to create wings that, if in fact we ever got well past that sort of flattening of the curve, that we would have places to put and be able to place patients and those sorts of things.
Yeah, medical surge, definitely. Now, this is something that not a lot of people think about, and we do already have some resources set up for this. But our homeless population, so when we start talking about quarantine and isolation, and the difference between those, I'll explain to folks, is quarantine is what you do if you've been exposed, and the quarantine recommendation for this illness is 14 days, because the incubation period is between 2 and 14 days. Isolation is what you do if you're sick. So for quarantine and isolation, if we have someone from the homeless community that has been exposed and we need to quarantine them, there aren't resources for that. And we're not going to quarantine them at a homeless shelter for sure, or any of the resources in the community. So we do have some hotels set up that we can do that. And we've had to deal with this before with tuberculosis in the homeless community. So that's already set up. And just thought, as people are thinking of this, that's something that we don't often think about is some of these these special populations that we have to work with, and so the homeless is definitely one that we consider.
So before we finish, let's go back to that again. So I know someone who's now tested positive for the coronavirus.
Yep.
What should I do?
So if you have been, if they've tested positive, and by the way, we have one positive in Mesa County, and so people are thinking if somebody has symptoms, they're positive. They're not. We have one. So if that person tested positive and you came in direct contact with them, then you need to self-quarantine for 14 days. And that means staying away from your family because, then you could put them at risk. But I will say that you'll start to see symptoms on average at about day 5. But within that 14-day period, if you don't see symptoms, then you come out. If you see symptoms, then you isolate yourself. And one clarification to this that we're trying to put forth to all of our partners is we've all gotten this message that if you've gone someplace, then you need to quarantine. That is really disrupting a lot of workplaces, and that's not my recommendation. My recommendation, if you come in someone that you know is positive, you need to quarantine yourself. If you've gone to a vicinity that's been highlighted, you need to self-monitor. So that means you can go about your daily business, but just be fully aware that you may have come in contact with someone. Self-monitor, and at that very first onset of symptoms, and you'll know it more now that you're thinking about it than you would if you let it go for a day or two. That very first moment, then you need to isolate yourself. So, because I feel like the communication about quarantine has been a little misleading, and it's caused a lot of panic in the community. And so I would rather even pull back to self-monitor, quarantine if you come in contact with a known person that's got this thing. So.
Well, Jeff, we appreciate you taking time.
Yeah.
You're probably the busiest person in Mesa County in Western Colorado, and so we really appreciate it. We're lucky to have you, given your experience in Nebraska, right, with a previous pandemic. And
yes.
So, gosh, just so nice to have you, and so nice to have you here today. So thank you.
Yeah,
for
thanks
taking
for the
time.
opportunity. You bet.